It's always been a little bit of a mystery to me. This is the office that is the lead implementation force, the referee on needed guidance for consumer states and insurance companies on the Affordable Care Act. But nowhere in the Affordable Care Act is there any reference to the Office of Consumer Information and Insurance Oversight. It was a fabrication by the Secretary of Health and Human Services. Now, when the committee began to look into this in November of 2010 and January of 2011, the agency morphed into the Center for Consumer Information and Insurance Oversight and was drawn back into the Center for Medicare and Medicaid Services. And it's been tough to get information out of this agency. Yeah, sometimes it has come, but it's come in small morsels, and it's required an inordinate amount of staff time in order to get the budgetary information, and by the time we receive it, it's frequently months out of date. Well, the operations of the Office of Consumer, or the Center for Consumer Information and Insurance Oversight, are now under the aegis of the Center for Medicare and Medicaid Services. This is the most powerful health agency on earth, and indeed that the earth has ever known, certainly within the federal government, because they have under their control now Medicare, Medicaid, S-CHIP, and for the first time, with the passage of the Affordable Care Act 2 years ago, private insurance is now regulated by the federal government in the Office of Consumer Information and Insurance Oversight. So it is essential that we as an oversight body maintain the oversight over this, now this very large and crucial organization. We got a Supreme Court hearing going on, a Supreme Court case being heard next week. It'll be very interesting to know what the contingency plans are at HHS and SOCIO should the Supreme Court not rule the administration's way. I'll yield back the balance of my time.